you have these stereotypes ingrained in your mind that this is how people behave or this is what they experience, and you don't really humanize people to individualize them and just say, when she says she's in pain, you don't just say, oh, it's going to be
You're
fine.
fine.
You'll be fine. You'll be okay. Versus this other person who's going to get an epidural at 1 centimeter,
Mhm.
uh, and
Well,
I don't know where that comes from.
Well,
Yeah.
I think it comes from, I mean, that was one of the things that scared me, Dr. Freeman. It comes from seeing the images of Black women doing slavery or being practiced on and saying that you don't feel pain, right? I
Yeah.
mean, that is rooted in that. And if we're not disrupting that, then it's still in the subconscious, the strong Black woman. That's why I told my husband, stop calling me that. I don't want to be strong,
There's a
and so much you're hearing about Black women wanting a soft life. Like, we don't want to carry everything on our backs. We don't want to, walk around with a badge of honor saying we didn't get an epidural to, like why? And to your point about humanizing, and I know this is going to sound, and Helen's going to know I don't want to say this, but that's why I wrote Black Boy Joy, because I felt that the images that featured little Black boys did not just feature them in everyday stories. They were a thing, and athletes and civil rights. And then when you don't see Black boys as people who have mamas that love them, when things happen to them, you can put it off. And I think that's why George Floyd was so impactful to people when he called out for his mom, because that was one of the first time that people was like, that's a human who
Yeah.
has a mama. And so
Mhm.
when you're treating your patients, do you see me as a Black woman that's bringing life into a woman that's bringing life into the world? Or do you see me as a strong Black woman that's going to tough it out? And, so I think that there probably is some bias, because there's bias everywhere.
Mhm.
I
Yep.
think that's, and I'll be very interested to see your episode on doulas, because I think that's a valuable role that, for instance, a doula can play
Mhm.
in the right setting with the right tone, because some women need an advocate for them in labor.
Yes. Yes.
And sometimes it was me, because sometimes
Mhm.
I would be there with the patient and I would come in the room and I would perceive what was happening, and it would be a little intimidating to some people. But I used to always tell the nurses, if you're doing what you're supposed to be doing, you shouldn't be intimidated, and patients would come back later in the office and say, when you walked in that room, everybody just kind of, because I could see what was happening and I
Mhm.
could see what they were thinking and I could see what they were doing.
Mhm.
And they probably weren't aware that that's what they were thinking or doing or behaving, but I could see it. And I'm sure the patient could see it, and I'm not saying anything totally untoward, but just sort of, things might be not the way they necessarily should be.
Yep. Yep.
Um, and
Well, I
so,
mean, and sorry, go ahead.
yeah, so when you walk in the room and you'd say, let's do this and let's do that and let's make sure this is happening. And then all of a sudden everybody starts kind of running around, it just kind of makes me wonder, if you're not there, what are they doing? Or
Mhm.
if you're home and you're just waiting for the delivery, what are they doing? And I think
Mhm.
sometimes it annoyed them that we were as hands-on as we were. But like I said, these are people we've taken care of for 40 weeks. And so, we also wanted to come and see them every couple hours and make sure everything was right and make sure, they were having a good experience and people were doing what we had told them to do. And so when I look at the 20-year career we had very good outcomes. I mean,
Mhm.
we had, things happen, every now, one patient, just anonymously, I can say, she came to the office postpartum and she said she had a really bad headache. And I think her blood pressure was normal. And I remember my partner sent her to the hospital because she had this bad headache. And anybody else would have said, you're just tired. She had
An aneurysm?
she had an aneurysm. And it was like a young person. And it was just kind of like weird stuff like that, where I realized some of the weirdest stuff that we would pick up would be somebody just complaining about something that seemed non-essential. I mean, like not that big of a deal.
Mhm.
Like, my legs are swollen. Come in. everybody, I remember, like, we always were like, come in for everything. Everybody would come in for everything. Baby's not moving. Come in. I
Mhm.
think I have some dish. Come in. This is happening. Come in. And we would see everybody in the office and
I mean, it's the personalization for me.